Okay, we're back, and one thing Gray did ask was whether or not who could prescribe what, and obviously MDs and DOs can prescribe anything they want to, and that would be true of probably like marijuana and things like that, and that's a state-given power. The state regulates that. APRNs, advanced practice retiners, can prescribe just about any medicine, what we call dangerous drugs, which are any controlled drug by the FDA, but they are limited unless they will work under a physician's license for the first 2 years to prescribe controlled drugs, and then after that, after a couple of years, then they go off on their own, and then they can prescribe controlled drugs on their own. You have podiatry medicine, chiropractic, I believe, can pretty much prescribe. They're controlled by a separate board, and they can prescribe some medications too. Then you have, it used to be optometrists could not prescribe anything, but now they can. That's always changing. So I think basically, you know, you have to check with each individual licensing board to determine what they will and can't prescribe. So we have Chuck on the phone. Chuck.
Hey, Doc, can you hear me okay?
Yeah, I can.
Okay, great. I've been watching this series, Truth About Cancer, which is about a 15-hour series of videos on alternative therapies, nutrition, on and on. At any rate, they ran across something in part 3 that really blew me away and kind of answered President Carter's miracle cure for melanoma. If you remember, I talked about that in other shows, where he went from stage 4 to totally cured in less than 6 months. And what they talked about on this Truth About Cancer was this thing called Rigvir, R-I-G-V-I-R, which is named after Riga, Latvia, and the Vir stands for virus. And let me read this thing off their website. The enterovirus Rigvir is the ECO7 virus that can be found naturally in the intestines of healthy young children. The virus coexists with other microorganisms in the intestines without causing any side effects. This means patients can take it for long periods of time without fear of adverse reaction. In fact, doctors have noted Rigvir actually strengthens the immune system and helps the body prevent cancer. And it says, how does it work? It's one of a number of viruses that are oncotropic, which means they migrate selectively to cancer cells. The virus enters and then multiplies within these cells through a process called oncolysis, which destroys them. And at the same time, the virus makes the cancer cells visible to the body's immune system. Many tumors develop the ability to mask themselves from the immune system, which is why the body is unable to fight them off, blah, 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 blah. At any rate, this is only available in Mexico naturally, not in the U.S., not just Mexico, but throughout Europe and certainly in Latvia, which is an old Soviet Union thing. And what's remarkable to me is it was developed in the 60s and 70s. And has been they've been keeping a lid on it. But to me, it makes absolute sense that a young person has something in them, and probably lots of things, that helps prevent disease. And then as we get older, both our immune system degenerates, and these things that help prevent them go away for some reason. And I'll kind of throw it over to you. Because it just is amazing to me how this has been kept from us and the potential that exists in the future, not only cancer but other diseases.
Yep. And I think what you touched on was this whole underlying genome stuff that they're picking apart and how they're now able to look at DNA structures and things of that nature, and they've had oncoviruses, which means tumor-producing viruses, out there for a long time. And when I was a medical student, I saw somebody who worked in a lab that was experimenting with oncoviruses, and I was at MD Anderson, and this poor young person was dying of some strange cancer that nobody knew nothing about. And it was obvious to me, as it was to probably anybody else who wanted to admit it, that whatever virus he was working with had caused him to develop some type of cancer. So to say that viruses can change things one way or the other, and I certainly think that's true, but and I don't know that specific paper you're talking about, and I probably have to see it just to digest it, kind of having you read it to me and trying to think about it. It's definitely an interesting topic, and chemotherapy and the drugs that we use today are basically regimented. They're very barbaric. They actually wipe out your immune system to wipe out the cancer. So cancer chemotherapy doesn't work. It really is a palliative form of treatment. Maybe if you caught it early enough, you may be able to rid that, but to think about destroying good tissue to get rid of bad tissue is kind of what we call barbaric. Like if I have to get a wart off you, which is a virus, I have to actually destroy the skin and the wart and destroy the tissue around it. But really what I'm doing is I'm inflaming the tissue enough to where your immune system comes in and picks up the virus and actually makes an antibody to it, and then the virus goes away. So warts can exist for years before your body actually will destroy them, and it just depends on how you irritate the skin to pick them up. And that's true with all types of things. Now, what we have when we're born in children is this huge undifferentiated thymus gland, which sits right here in our mediastinum. Well, that is undifferentiated T cells within the white blood cell compartment of our body, and T cells, lymph cells, and they're what they call undirected T cells. So as you get exposed to certain substances, your body commits those cells to memory to destroy that particular agent. As you get older in your 60s and 70s, you start to lose those undifferentiated T cells. And unfortunately, they basically, you can't make new antibodies to new things. So if you were to have been harboring a tumor for a while or get exposed to something along that line, cancer cells degenerate, then you can form a tumor and your body cannot fight it off. There's a lot of research going on in that, but just to briefly, let's talk a little bit about maybe one of the things that, if we know about, is called the BRCA2 gene mutation, which was identified to causing breast cancer. Well, estrogen, if you have the BRCA2 gene mutation, estrogens that females make in their tissue, and really they don't necessarily have the ovaries to make estrogen. I mean, it comes from the fat in their body. And we know that because if you take a female and she's a marathon runner and she has no body fat, she does not menstruate because she doesn't make estrogen. So when you have this BRCA2 gene mutation and you have estrogen, estrogen tries to preserve the breast tissue. It tries to keep it alive. So if a tumor cell were to be formed and a breast cell is mutated and dies, then it cannot turn into cancer. But if estrogen comes in and tries to save that cell from dying, then it mutates and then it forms cancer. So that's why everybody who has the BRCA2 gene mutation will develop breast cancer, because they're a female. They wouldn't be a female if they didn't have breasts, except obviously if they're maybe a sex change operation. But other than that, they're still going to take estrogen, but there's a different structure there. But anyway, I'm digressing a little bit. But if you're a female and you have breast tissue and you have the BRCA2 gene mutation, you will develop breast cancer unless you remove the breast tissue. You can take anti-estrogens, but you cannot get rid of every estrogen in your body because the fat tissue in your body is making that. So it would be a hell of a life, get your breast tissue removed and jog until you actually have no body fat to prevent yourself from getting breast cancer. I mean, that's insane. So to say that tissues die and they don't mutate is fine. To try and keep a tissue alive long enough to allow it to mutate to turn cancer and then have a deficiency in your immune system might allow that cancer to take hold and then start to do that. And the idea that the immunotherapy to get your white blood cells or stimulate your white blood cells to make new antibodies or to kill cancers is the only way we're ever going to be able to beat cancer. And to say this stuff has been around since the 60s is probably true. And then that gets into the whole underground deal of you know, the FDA and money and all this other stuff. I mean, I learned that they wanted to change the label on metformin because you can actually use metformin in lower forms of kidney function, but nobody's going to change the label because it costs $1 million. You have to petition the FDA to change a label and it costs $1 million. You're going to pay $1 million for something that's generic. So therefore the labeling on metformin is still be careful of you know, glomerular filtration rates below 45. But actually, you can use it down to 30 or lower in kidney function. So it's you know, it's just absolutely insane. I think it's, in my mind, it's basically moderation, doing what you do in moderation and not going too far out there, because once you do things too much, you suffer those consequences. So thanks for the call, Chuck. We'll be right back. Hopefully someone else calls after the break. Thank you.